If you're selling Medicare and you're not cross-selling health ancillary products, then what are you doing? You're leaving so much money on the table. Hi, my name is Jackson Taylor, and I'm the VP of Sales here at Brock Partners. And what I want to talk about in this video for the next few moments is cross-selling health ancillary products. That is one of our primary niches that we have mastered. We obviously mastered Medicare, and we've done very well there, but we've also done very well cross-selling health ancillary products. And I'm going to go over a couple of those things with you today. I'm going to go over things like carriers. I'm going to go over things like commission. I'm going to go over things like underwriting, and I'm going to go over pitches that we use to sell these products. And so when we're talking about selling health ancillary products, what does that really mean? Well, these are what I would call almost like secondary products, but that's not really the term. It is health ancillary products. But in a way, I like to train agents, especially the LOAs in our office, I like to train them to think of it almost like secondaries. And that's important to the strategy that we use to cross-sell. We want agents to think of these things as if though they work in coordination with the primary Medicare plan that they sell. And I am talking specifically about Medicare today. However, we do sell these with ACA, short-term medical, other types of products. We cross-sell health ancillary with everything that we sell. But in the Medicare space, we have what we call two core products. That's Medicare Advantage and Medicare Supplements. And we cross-sell effectively with either one of those types of products. And that's what I want to teach you in this next few moments. What am I teaching somebody who's brand new? One of the LOAs over here. And just to give you an idea, our LOA team is cross-selling at around 90%. That's where they're crossing is 90%, which is phenomenal in the space. It's phenomenal in the space. So let's start with this. Let's start with talking about what products we sell. What products we sell, and then what carriers we offer that with, and what commission they get. And then I can give you pitches as we go. So I'm going to start with our first product here, and that's going to be cancer, heart attack, and stroke, or CHAS. They call that cancer, heart attack, and stroke. We sell these like hotcakes. We sell literally hundreds of these a week, hundreds of them. We do very, very well with these, and we do that with Medicare and ACA, but I'm going to talk about specifically with Medicare, though it doesn't change how it works regardless. Hey, cancer, heart attack, and stroke, how does this work? Well, it's a lump sum policy, meaning that I can customize this policy to pay out a lump sum for either cancer, heart attack, or stroke. And really, cancer and heart attack and stroke are both like one different thing. Cancer is typically by itself, and then heart attack and stroke are together. It's how they typically work. And in some of the carriers that we sell, you can put them together. Some of them that you have to write separately. It can look differently. But it is a lump sum policy, or lump sum policies, depending on what carrier. You have to split that, and I will go over that with the carriers. But it is a lump sum policy. Now, what's cool about these policies is that depending on what carrier we go with, it can pay out somewhere between 90 to 100%, depending on your level. But that's going to be street level. We'll call it street. 90 to 100% street, meaning that I'm going to get a 90 to 100% commission on the annual premium. So I'm going to put that on here. Annual premium, right? Of AP, which is very important to remember. Some carriers pay advance, some pay as earned. We'll talk about that with the carriers that we go over in just a moment. These are very low premium policies, meaning that it's going to be very affordable for my customer. Very affordable for my customer. It's not going to break the bank to add this in there, and they are very useful with Medicare products. I'm going to talk about that as we go into this and talk about the carriers and the pitches that we use. But CHAS, very great policies and lots of great things about them. Now, who am I really selling? Well, I'm going to give you the order that I'm selling these in right now. Number one that we sell is Heartland National. Heartland National is the number one option that we're selling right now with these CHAS products. And what's really cool is I can combine these. So I can combine the cancer, heart attack, stroke, or I can write separately. separately. So I can either combine it or I can write separately. I can either make cancer my primary option on these plans and add a heart attack and stroke rider, or vice versa. I can write a heart attack and stroke policy and add cancer as a rider, or I can just write them separately. I can do cancer by itself, or I can do heart attack and stroke by itself, which is very beneficial because maybe I can pass the underwriting for one or the other and not the other one, you know. So it's very nice to be able to pick and choose there what I'm going to do. Also, there's some great riders. There's some great riders with Heartland National. Specifically, the one that I like, the one that I like the most is the return of premium. The return of premium is one of my favorite riders about the plan. So there's two options with this return of premium rider. Let me explain. That's something we see in life insurance all the time, a return of premium rider. What this means is that I can pay an additional premium, and what's going to happen is at the end of whatever period I pick here, I'm actually going to get my premiums back if I did not use the policy for cancer, heart attack, or stroke, which is really neat, which means I'm going to use the policy no matter what. The two options are I can either add a 20-year return of premium, which means that if I've been on the policy for 20 years and I have that rider on there, then I would get my premiums back in a check, which is really cool. If I didn't use it in the 20 years, I get a check. If I did use it, well, I get a check. You know, either way, I'm getting money, which is going to be very useful. And then the other option is return of premium on death. If I were to die and I never used the policy, then I would get those premiums back, which is very, very beneficial. Another rider that I like a lot with this plan is a critical illness rider, which is an option I can add to either one of them, heart attack, stroke, cancer, doesn't matter, where it pays out an additional lump sum of my choosing as the agent or, you know, the policy chooser. Whoever writes the policy can, you know, customize it. It pays out a lump sum benefit for things like deafness, blindness, dismemberment, lots of different things there that would be considered critical illness. So we really like this this policy. Also, it has a low smoking rate. What do I mean by that? If somebody's using tobacco, then this plan is not going to be crazy expensive. This plan is not going to be crazy expensive. A lot of cancer plans, rightfully so, the premiums go way up if somebody's using tobacco. Well, Heartland's not going to change it very much based off of that, which is really nice to have. The second one that I'm going to talk about here, is Aetna Senior Supplemental. And they have both of these. Now, I can only write these separately. I cannot combine them into one policy. Now, I can write them on the same application. Well, not even the same application, but I can put the applications together into the policy, or I can put the applications together into the back office as I'm writing it and do them at the same time, which makes it easy. But I cannot combine them into one policy. I have to write them separately. So I have to either write cancer or heart attack and stroke is how I would have to do that. However, I do like that this has a low smoking rate or tobacco rate. It also has nationwide availability. Nationwide availability, meaning that this is available in more states than what maybe Heartland National is, which is really cool. One thing that really stands out about Aetna's plan is this: no height and weight question. No height and weight questions, meaning that if my client maybe is on the heavier side, or maybe outside of that area that I need to be with height and weight, I can go Aetna and it's not even going to ask that question. It's not going to ask about height and weight, which is really nice. And then number 3, I have Bankers Fidelity. Bankers Fidelity. Low rates in general. This is going to be the lowest rate out of all of them. Now, something I need to keep in mind is that my smoking rate is the highest. Smoking rate is the highest out of the 3. It's the highest one. So again, I need to keep in mind, the smoking rate is the highest out of the 3. So my smoking rate is going to be the highest. So if I'm going with someone who smokes or has tobacco, I'm talking to someone like that, then I need to keep in mind that this one's going to cost the most. If not, it could be my most affordable one. One thing that I did not mention on the first three, I should mention real quick, is Heartland is going to pay out a 9-month advance, meaning that you're going to make 9 months worth of commission up front when you write the plan, and it's going to pay 12 months, and then Bankers is going to pay 6 months.
Yes, there's always going to be a little bit of work to put into that.
The good news is that all three of these are going to pay out somewhere between 90 to 100%. And just to make the math easier on myself, I'm going to do these all at 100%. But keep in mind it is 12, 9, and 6 month advances. So if I write this policy and I'm getting 100% of the commission, let's say that I write the average one, and the average policy that we're writing is, the sweet spot is like the 15K, meaning that I write a lump sum benefit of 15,000. That's the area that we choose for the customer, meaning that if they get diagnosed with cancer, heart attack, or stroke, they're going to get a $15,000 check that they can use how they want to use. If I write that 15K, which is the sweet spot, that typically is going to equal right about $45 in monthly premium. Now I do my math, 45 times 12, that ends up being $540 of annual premium. $540 of annual premium. And if I'm making 100% on that commission, then that means I'm going to make $540 on this product up front. Now, of course, if I get a 12-month advance, so if I go with that, now I get that 12-month advance, then I'm going to make $540 up front. If I get a 9-month advance, like with Heartland, what I'm going to do is I'm going to get 45 times, we'll call it 9. I'm going to get $405 up front. And then if I write it with Bankers, I'm going to get up front $270. That's what I'm going to get up front. Now, when I get this advance, it's going to continue to pay on the other side for these two, and they have pennies worth of turnaround, residual, if you will, meaning that after the first year, they will continue to pay a commission, but it's very, very little. But really, most after the first year commission with these. This, you're getting the first year commission all the way up front. This, you're getting 9 months, and then you'll continue to get $45 for the next 3 months. And then over here, you're getting $270 up front, and then you'll get $45 for 6 months on the other end of that. So the payout there, you can see, I get this the quickest. That's going to be the slowest. But, also I have less of a chargeback concern over here. For a lot of agents, that's not an issue. For some, it is. So I like to mention that. That's kind of how the payout works. Now, let's say you write this with somebody you write a true-up commission for, or a true-up Medicare Advantage plan. I'm getting my true-up commission of $694 plus my $540. That's going to bring me right to, wow, couldn't have done that any better, $1,234. That's what it's going to bring me out to, $1,234 on a Medicare beneficiary that I write a true-up Medicare Advantage plan with or for. So that really can capitalize. I can almost double what I'm getting on that customer. So my lifetime value, my return on investment shoots way up. And let's say, I can do the same thing with MedSupp. Maybe I write MedSupp. I'm going to get about a $350 commission. Actually, let's call it $400. I'm going to get a $400 commission most of the time with us, depending on if I write a plan G or whatever. Again, $540. With that customer, I am getting up front $940 up front. That's what I'm getting. So I'm really capitalizing and bringing money, more revenue up front. And we have generated millions of dollars of revenue in cancer products in the past decade. We have generated $1 million of cancer of commissions, $1 million in revenue and commissions for these cancer products with our LOA team in the past decade. And you can too. You can generate a lot more revenue by doing this right here, by just adding a $45 policy. That's crazy that you can do it that way. Now, what are the pitches here? What are the pitches of how we can do this? My favorite pitch is this one right here. My favorite pitch is this one, IRA, the Inflation Reduction Act. In 2025, we have the Inflation Reduction Act. It added a $2,000 maximum out of pocket on all prescription plans, including Medicare Advantage plans. In 2026, that's going to be $2,100. So I tell the customer, you have a maximum out of pocket for your drugs of $2,100. If you get diagnosed with cancer and you start taking some kind of at-home cancer pill, you're going to hit that $2,100 easily, easily. Well, if I write a $15,000 policy, they're going to get a $15,000 policy. Now, again, they can use that $15,000 however they want to. They can use it however they want to. They can use that $15,000. They can go to Disney World if they want to. But I'm telling them in this pitch that we want to save it for this. We want to save it for the drug costs that come with cancer diagnosis, right? So $15,000 lump sum checks what they're going to get, right? I have a $2,100 max out of pocket, which means that I have 7 years worth of protection against my $2,100 max out of pocket, right? 7 times, 2, or we'll do 2,100, 15,000. So I get a $15,000 policy, $15,000 lump sum check. I can pay my $2,100 max out of pocket for 7 years. And so the way I like to explain to them is technically with this coverage, to the customer, I like to say, technically with this policy, with this lump sum, you have 7 years worth of protection against your $2,100 drug out of pocket, which is a very, very good pitch. The second pitch that we use here is non-medical expenses. Non-medical expenses, which is just meaning I'm going to use this to pay for things like if God forbid I'm diagnosed with cancer and I got to replace income. Or maybe I have to pay rent for like a house or an apartment in a city that I'm going to. I need to pay for gas, pay for a caretaker, right? Whatever it may be, 53%, big whopping 53% of cancer expenses are non-medical related. Having an extra 15 grand to help cover those things is very, very, very beneficial, especially when this costs a little over $1 a day to have that policy in place. So those are your 2 pitches and 2 ways that they work with Medicare plans for everybody. And really, you can even add a third pitch. And I do this jokingly. That third pitch could be, do you want this? You can honestly, do you want this? You could honestly not even pitch it very well and just say this every time you sell a Medicare core policy. Do you want this? Do you want cancer coverage? And you will sell it to 5 to 10% of the customers you sell. You don't even have to be good at it and you'll sell that many. If you get really, really good at it, you can get to 90%. That's where we're at, right? The next type of policy I want to talk about is hospital indemnity, right? So I want to talk about hospital indemnity. We also label that HIP, hospital indemnity plan. The way these work, they are fixed, or plans to have a fixed amount. They pay out a fixed amount for specific services. They pay out a fixed amount for specific services. I can customize these plans to pay out a fixed amount for this service, that service, this service, that service. And I'm going to go over the specific ones in a moment that we use for Medicare. Now, we do write these for Medicare Advantage plans. We don't write them for Medicare supplements. It doesn't make sense to do Medicare supplement because Medicare supplement's already paying for all of my expenses that are out of my pocket or whatnot. So I don't really need it there. But for a Medicare Advantage plan, these work very, very well because I have large copays, I have reasonable copays. We like to use this to cover the copays that are on the larger side. Now, with this plan, what I'm seeing is that most of these, I'm going to show you by carrier, they're going to pay out somewhere between 60 to 70% of the annual premium. That's where it's going to pay out, somewhere around 60 to 70%. And what we're going to see here is that the premiums are higher. And when I say higher, I don't mean they're hundreds of dollars. It's just higher than what the cancer plan is, right? And we only sell these for Medicare Advantage, so I'm gonna put MAPD only. Now that's only for this video. We do ACA too. We do ACA, we do short term. So we still write these with other things, but when it comes to Medicare, we only do it with MAPDs. We don't do it for MedSupp. Now, what are my top carriers here? My top carriers. Number one here, we have Medico Wellaby. Medico Wellaby. Medico Wellaby is a hospital indemnity plan that's out there. and we really like them. The commission structure is going to be similar to what the other ones are, and it's very competitive. And the commission space is also competitive in the premium space for our customers. Now, what we really like about the Medico Wellbe plan, what we really like about this Medico HIP, is that it is guaranteed issued for ages 60 through 79. 60 through 79, which is really awesome. Being able to get a plan that's 60 to 79 and then the commission rate still be competitive is huge. Most guaranteed issue plans that are guaranteed to issue that long really bring the premiums way down. We really like that about this plan. Number 2 here, we're going to put Aetna. Aetna Senior Supplemental. This one is guaranteed issued 64.5 to 65.5. 64.5, 65.5, and what we really like is that it still asks no height and weight. Really cool. The third one we're going to do here is Bankers Fidelity. Bankers Fidelity. This is my rate buster. This is my rate buster. That's going to be the lowest one. That's going to be the lowest premium, of the 3 right here on Bankers Fidelity. But it does a great job. It also is going to have more strict underwriting, but it is guaranteed issued 64.5 to 65.5. 64.5 to 65.5, which is great. Now let's do some math to motivate you. Why would you go this direction? You know, the average premium for a 65-year-old, if you write it the way that I would write it, it's going to come out to about $75. That's where it's going to come out to. That's about the average monthly premium, right? And then we do 75 times 12. That's going to get me to $900. $900 in annual premium. And if I make, let's say, 65% of that, I am going to get a payout of $585 in year 1, right? And again, if that's, let's say that's a full 12 months, so I have a 12-month advance, I'm getting $585. $585. If it's a 9-month, let's do our number here. 900 times. All right, back to it. If I have a 9-month advance, I'm getting something like a $439 payout. And if I have a 6-month advance, I'm getting something like a $293 payout. And just like with the cancer, I get all of it up front for the whole year. I'm going to get 3 more months worth of commissions, which is going to be about $49 each month on the other end. And then again, another 6 months of the $49 on that end. So that's how that pays out. How do I build a HIP? Let me show you. When I build a HIP for somebody, and again, the pitch is really this. If you're on a Medicare Advantage plan and you want to avoid those high out-of-pocket expenses on things like copays, the high out-of-pocket copays, then you want a hospital indemnity plan. And the way that I customize it for Medicare Advantage beneficiary is this. I have the hospital. I add ambulance. I add surgery. I'm going to add ER. And then I may add skilled nursing if their budget allows, right? From here up, that's going to be that $75. If I add this, it's going to be more like $100, right? But I like to match what's going on. So I like to look at the plan. Maybe the plan has a $300 for days 1 through 10. 1 through 10. $300 copay per day for days 1 through 10. I'm just going to match that. So on the plan, on the hospital indemnity plan, I'm going to add hospital protection for days 1 through 10 and $300, meaning it's going to pay $300 a day for days 1 through 10, which is going to cover the cost that they'll be spending for a hospital stay on the plan. For ambulance, if I have, let's say I have a $250 copay, I'm going to match it and round up, So I'm really going to do something like $400 there, I'm going to put on the hospital indemnity plan $400 the rider that I'm going to add it at. And then the surgery, let's say it's a $250. Again, going to match it and round up. So I'm going to do this at something like $400. Right? So now they're going to get a $400 payout for either ambulance or surgery. They're only paying $250. They may make money, though I don't really pitch that. ER, typically that's something like $150 copay. So I'm going to do a $200 payout. You can see there, that way we have extra cash. We're better safe than sorry in that situation. And then skilled nursing facility, I would just, match it. It would be days 21 through 100 that I would add there, because days 1 through 20 are covered by the Medicare Advantage plan. The last one that we're going to write, and I'm not going to go into great detail because this is just kind of like, do you want prize of that sometimes? The last one that we're writing a lot of is dental, vision, hearing. Dental, vision, and hearing. All right, dental, vision, and hearing. I'm really just going to give you the carriers. Our carriers that we're writing these with are going to be Aetna Senior Supplemental. We write a lot of Manhattan Life. And then we write a lot of National Care Dental. And we actually have a separate video that will explain these more in depth about these carriers and how they work. But traditionally, the way that these plans work, these dental, vision, hearing plans work, is that they're going to be standalone dental that have premiums. And the premiums are going to be somewhere like, with Aetna Senior Supplemental, we're looking at something like $60 a month. Manhattan, we're looking at something like $55 a month for the top. And these are the top benefits. And the National Care Dental can be something like $70 a month for the top benefit. And so there's your prices there on those. And they do pay out somewhere between 25 to 35% a month. That's how they are. And they're all guaranteed issued. And they're going to pay on preventative,
All right.
basic,
That's good to know.
and major services. They're made up of waiting periods. You really just got to get in and look at the brochures of these plans. But we will have another video on these specifically. But those are your 3 cross-sell products. And I'm telling you right now, we have produced a lot of revenue selling these plans: cancer, heart attack and stroke, dental, vision, hearing. We also do home health care. There's other things that we write, but those are your top 3 that we're selling. And you can really do a lot of damage. You can make a lot of people happy. You can get a lot of people extra coverage that they didn't know they need, or maybe they did know they needed, they didn't know how to get. And you can really make Medicare a great vehicle to sell in and to invest in as a business by doing these, selling these health ancillary products. So get out there, make it happen, and be a top Rock partner.